Oh, tak boleh doktor. Okay, when you feel like continuing, stopping, you come, I'll talk to you. But for now, you know a lot of issues, brother. I give them example, a lot of, I'm working in a dialysis center, doctor, I have a PIC there. One of the private center PIC. So I tell them how many people get a kidney loss. So the common thing is, mati lah, doctor. Enjoy dulu. This is kampung, that's why. Okay, anyway, for those who can convince, we tell what is necessary lah, in a very proper manner. Then ask them to come back. And the percentage of those who come back to me, maybe less than 99.9% never come.
Okay.
The problem is with the country. Why do you have to have cigarettes here? Right?
Yeah.
You know that substance can cause dependence. Nicotine is a dependent, one of the worst substance can be dependent. Doctors can get to it in spite of knowing all the
because the easily availability.
Yes, why do you want to have it? Why can't you ban it one shot? You get remuneration of $5 billion per year, but you spend about $10 billion for your patients here. Right? You don't have to subsidize if you don't have a cigarette. Take it out, see what happens. The cigarette is not there, you think people is looking for cigarette. Yes, for some time. After that, nobody will go for it. Right. So
do you think that also like
yes, doctor,
even promote you during your time that you are smoking?
Which one, doctor?
The you can easily buy it.
Doctor, it's so easy to get hooked on cigarette. If you want, I can teach you today, and be with me for 1 week. After that, you'll be addicted. So most of the people who just smoke, the children, they don't know how to smoke. They take it like that. The moment they inhale, it goes and form it goes into the blood circulation, it goes to the brain, and the receptors are activated. The receptor is supposed to give you a good feeling effect, confident effect, activation, right? Just go through about that. Activation, you feel fantastic. You have creative mind to think. I don't know. So now you tell me, with all this thing, are you not going to be addictive?
So how's your experience in stopping? Because you
tough.
Really managed.
This is, I think, 8 months ago. It was my 10th attempt to stop.
So do you use any all those nicotine replacement?
Patch. I use patch, and then I do exercise. Earlier to that, of course, I start the same way. I feel like when I'm motivated for exercise and then do the patch, all the thing works much better. But I fail sometimes. Sometimes any issue comes up, stressful issue. We do have stress. It's not like always cool, right? That stressful, you feel like you want to have cigarette. Right. Since I was there on patch for some time, and then I switched over to cigar. Cigar.
Okay,
cigar. And then slowly I cut down. I stopped my cigar patch. Slowly I cut down patch. I went to 7 milligrams while I was smoking cigar 3 times. And then I took out 1 cigar, one by one. I took out 7, the patch 7. I took out 1 cigar, and the second cigar, and third cigar. Now I don't smoke. But if I meet anyone, with my friend, once in a month, we have a bigger cigar. That's it for 40 minutes. Come on. Like sometimes I feel like, not sometimes, always I feel like smoking too, but I'm sustaining with it.
Okay, so you really can.
I can control, but I cannot say that I can go on later or not. I'm not very sure. Well, but going to Australia may give me an opportunity, because that's one of the lovely places where you can stop habits like cigarette smoking. I found everybody here, like the moment you smoke, they look at you like hantu. So I need such a place. I don't want to have any friends around who smoke cigarette easily available. It's better to focus on my work.
So you have your method. Those patients who's interested to stop, I mean, the 1% of those patients.
Actually, those people who come back to me, can I tell you, I use kind of a different approach for small stops.
Oh, so not the same thing which you tried patch,
not the patch,
and
but
exercise.
Macam ini. Sekarang kalau I see the patient psychology lah. If he can be threatened with word, I use different way of threat lah.
Okay.
Macam ni lah. Ini peluang terakhir kamu. Paru-paru you dah berubah. Kalau tak berhenti rokok, hancur. Jangan berhenti. Doktor berhenti. After 3-4 months meet them, do you smoke? Doktor, hari itu doktor cakap saya dah berhenti. Oh my God, I rasa malu kan. I don't know. Indonesians are quite good. Only more than Malaysians. Indonesians are fantastic. You talk to them, they trust you. Oh my God, the doctors are a different level. Sometimes you feel great. being a doctor, you tell them, everybody believes what you say, Of course, you may have some asthma, you cannot be allowing to smoke. Or some acute bronchitis or something like that. That's an opportunity you grab,
Yeah.
So that's how.
Okay. Another thing, do you ever have any like other illness, like you have fever, cough and cold?
Well, I don't get often like that. I get once in a blue moon of cough and cold. Cough not there
So normally what do you do?
I take high dose vitamin C. I put a drip. That's it. Over.
Oh, you mean a drip?
I put a drip.
Normal saline drip or
no,
what?
a small bottle, 250 ml of normal saline with 10 grams of vitamin C, or make it 20 at the time, and with the other cocktail of vitamins what I have, B complex and everything. Just lie down for a while. That's it. Over. I don't take tablets. At the most, I take 1 or 2 times PCM. The next day, I'm alright.
Okay.
And this thing happens once in 2 years or once in 3 years. I don't get often like that. Unlike those days.
Oh, okay.
Unlike those days, I never get recurrent viral infection. I'm exposed. I don't take extra mask. And of course, I've taken this one influenza injection. I take, but then this time I've taken about 3 months ago. Prior to that, I never taken.
Oh, so this is the first time?
It's the first time taking. Earlier to that, since I'm in hormone therapy and supplement, I don't get disease Basically, the intercurrent diseases.
Well, what triggered you to take the influenza injection?
It is good, doctor. I've been a smoker earlier, and then you get a lot of different strains coming in. H1N1 strain. We don't know what's happening around the world now. But I would rather don't touch it But then exposure to the patient again, right? You're exposed to the patient. You're working with the foreigners as well. But we don't know where we are sailing, So another thing is I wanted to give my children that kind of a treatment. So I inject them with influenza virus.
They also got influenza.
We have
how old are your children?
The first one is 14 years.
Okay.
Second is 11, third one is 9-year-old. All 3 girls.
So they all got their influenza shot?
They get influenza shot, and then they take that Cevarix vaccine, the other one. School provides them that, So that's okay
Okay. So for patients, that's what you mentioned just now, that you also recommend the vaccination.
Yes, doctor. That is again depends on the people Basically, old age people, more than 50, 40 or whatever age, or those who got comorbidities, I advise them straight away to inject
the influenza.
And also pneumococcal Correct, with diabetes or even high HD, chronic renal failure, I don't wait That's what my concern is about. It's very important. Otherwise, when I do the blood checkup, annual screening for a patient, I tell them, have you taken vaccination on this? Belum lagi, doctor. Why don't you consider taking it? It's meant for this I may not make influenza pneumococcal compulsory for them, but at least if you want to take influenza, it's fine
So at least you offer.
At least I offer That's a part of my advice
What about for kids?
For which one is that?
Kids, children.
Children is nothing much, doctor, because we have got a routine vaccination that we are giving all the time.
The national.
No, we follow the national, but of course we go beyond the national we have other influenza like HIV, the pentaxim, all this influenza.
So influenza also you give to children.
A lot, yes, we do vaccination and then private sector, they have other vaccines, doctor.
Yeah, they do have.
Additional also, it's not in the national scheme but we advise on what is given by the private
Okay.
Right.
So you do give some extra things
extra stuff all the other vaccines
in your clinic.
Yes, we do that.
Extra
that's quite easy, doctor, because they
like
ask
influenza
they ask for influenza vaccine untuk umum ni, then we buy and keep and then when the time comes in, we've got a recall system. So when the patient wants to come in, they just have to call us 1 day early, or we call them 1 day early. Then they come over. By then we buy the vaccine and keep ready. We don't stock up vaccine. We don't stock up.
Yeah, there are other things they used to give in private, like pneumococcal. That one also.
Pneumococcal is a part of the national vaccination, I think.
It's not yet.
Not yet, You need it for the high comorbid people. IHD on this thing. It's a compulsory vaccination in Australia.
In Australia, a lot of compulsory.
I do it here.
Okay.
I feel that's good because
you mean you feel the Australian guidelines in vaccination
I wouldn't say that.
More complete,
let me tell you, these people are supporting the government, but vaccination is compulsory, no question asked.
Definitely
Okay, and particularly you see our patient here with diabetic and also IHD, they get into trouble. intercurrent pneumococcal infection, community acquired pneumonia. We have loaded patient over there. If you can prevent with pneumococcal vaccination, you can prevent the deadly pneumonia and all things, right? So consider that lah, take it. So I make it compulsory here.
Okay.
I think that's a good call. You know, you protect the old people.
Yeah, that's
and they are very expensive. Their geriatric is beyond our imagination.
Of course.
So we take it lah. You know, it's a good one. As what we a country which follow vaccination here, we have to tell and we have to follow that.
What about those patients with cough and cold? I mean, for yourself, you put the drip with the thing.
For my patients, doctor, the cough and cold is very simple, low grade temperature. What we do is, of course, we give them, if they can work, they can work lah. Can't work, give a day off for half a day. But on the other hand, of course, I ask them to be good at their diet. I ask them to take 2 eggs in the morning, 2 eggs at night. Chicken, fish. No, this is what I advise them. More protein. Viral infection. Alright? Viral infection. Cut down, of course, coffee, tea, all they have to cut down lah. Sweetened stuff lah. And then basic treatment, symptomatic treatment most of the time. PCM, paracetamol. They got runny nose, all this thing. You give them a simple case. Like may not be for the daytime or night, if it's crippling or anything. Just give them some antihistamine lah. And most of the time, definitely you don't give for asthma patient treatment. So we follow the standard routine symptomatic treatment lah. Right? Symptomatic treatment. But sometimes I do believe the pure virus with the body ache and everything, it's always good to give them a prednisolone injection, which is 1 cc. That comes to about, not mistaken, how many doses? 25 milligrams. It's that dose. Not to be routinely practiced, but if you're very sure the person is not be alright, viral infection, the myalgia and all this thing, after investigation, prednisolone works well. Why? When the viral sets in, viral infection sets in, the viral only sets in when your cortisol protection is lacking of that. Alright? It depletes your pulse. See, for example, you go for exercise today, you work out, the next day you get running. Have you experienced that? The next day you get body ache and viral. Have you gone through that? You wonder why that happens. By right, we are doing exercise, we should not get disease. But why the next day, why you get all these things? Because we exert ourselves. When you exert more, your cortisol will get depleted. Cortisol is our hormone adrenal cortex, right? So when you deplete the cortisol, it goes down, there's no protection, it's anti-inflammatory hormone. So the next day, something around here comes back to your own body. So then you get viral infection, then followed by bacterial infection. That's because of cortisol deficiency. So what we are giving is synthetic cortisol, which is nothing but prednisolone. 1 cc, you'll be alright.
So the patients will be alright.
Will be alright. Okay.
But for yourself, you don't really.
Well, I don't take prednisolone, I take hydrocortisone.
When you have cough and cold.
I take every day.
You take. You take the.
So that's why.
So that's why you don't.
That's why I don't take lah. So that's why I'm justifying. You know, they say, the doctor is giving steroid. Yeah, I take it every day. Right. I don't have buffalo hump. Do I have? No buffalo hump.
No.
Nothing. Right. I take about 10 milligrams of hydrocortisone every day. There's no bony loss or anything. Rather, my bone is stronger. Right. So these are the things. You know, you don't bang people with 10 tablets of prednisolone for as you treat a rheumatoid arthritis SLE for 1 or 2 months. That's wrong. That means you don't know how to treat the condition. Immunological disorder, think immunologically. If you cannot do it, give it to the integrated doctors to do it or researchers to do it. Isn't it? Right? And then bang the patient on all this Celebrex. Which Celebrex is good for the kidney? They also NSAID group of NSAIDs, right? The COX-2 inhibitor. Almost similar to the NSAID. So give them 1 month, 2 months. No, about that. That's not the way to treat.
Yeah. But for yourself, when you have cough and cold, you take more protein also?
Which one is that?
When you have cough and cold.
Oh yes, I love to take protein. Some good preparation will go on my house I love to take protein at that time.
So for cough and cold,
you have to feed, doctor.
You have to feed.
You have to feed the virus, starve the bacteria. Okay, they say that old saying, right? But for me, you have to feed both.
Okay, so you increase your protein intake.
Yeah, it's not like cough and cold. You rest more. You rest. Have nice soup. Have good protein. I don't know why. I feel like taking protein a lot during a viral phase. Sometimes I enjoy having viral fever.
It makes you feel better.
No, it's not that. Once in a while, you have something nice different. Once in a while, it's so nice to have. As long as it doesn't go beyond that line,
is it?
But that is the time. It gives me an opportunity to learn my own tablets. You understand, doctor? See, for example, those days lah, the last time, smoker, they get urinary upper respiratory infection, whatever, you can have a lot of phlegm coming out. Plenty of phlegm. Now, what is the treatment for cough in a smoker? That's a question. They have got chesty cough all the time. That will never last. And then they smoke. Bena expectorant, for example, right? Supposed to expectorate the phlegm. It doesn't work. You can't give cellulase because it's a suppressant, cough suppressant. For those who are taking the cough in smokers or in a smoker with a lot of phlegm, the best choice, if you ask me, would be Precanil or Ventolin tablet. But don't give full dose. Give them half dose, half the dosage. It opens up the bronchial lining, the bronchus. Easy to breathe. You give them a bit of bisolone. Bisolone is the one which you use for diluting the phlegm. Give them twice a day. Easy to breathe, cough are also easy. Okay, that's how we think. Sometimes, I'm not saying it's a great practice or anything. We have guidelines, but for me, the guideline is what I've done for myself. Okay, what I do for myself.
Yeah.
That's
so your own experience.
My own experience
will guide you.
Yeah. Right?
Okay.
So my patient treatment depends on what I do, and whatever medicine I have, I would want to take in my clinic. Though it may be generic, but I trust the medication. Only thing you have to know the proper dosage. A GP who don't know the diagnosis can never treat any patient. Right? Yeah. Actually, the patient has a lot of diagnosis. If GP focus on the outside 80%, and inside diagnose 20%, I tell you all the cases are treatable. Like plenty of cases. Like shoulder impingement, how to test it, all the testing, simple tests. Yes, neck spray, and then severe headache, always a chronic headache, occipital muscle inflammation, occipital myalgia. Right? We have something called occipital myalgia. Simple term. Over here, just do a massage for the patient. We'll be alright. You don't have to bang them on painkiller for forever. Logic lah.
So painkiller is not something which you.
No, we don't have. I don't like to give painkiller. At the most 3 days, doctor. At the most 3 days. I rather prefer to give prednisolone for 10 days than giving NSAID for 10 days. Asthma, prednisolone is accepted. Nothing happens to them, right? Why can't give anti-inflammatory for other myalgia or other cases of muscle strain? It's going to reduce inflammation, right? Safer, right? See, that's why I really don't understand sometimes.
Because of the safer.
Macam NSAID memang hentam buah pinggang. Kalau let's say for example, kidney, what do you call chronic renal failure patient comes to you with some pain, you give them PCM, right? Then not enough.